Welcome to this on-demand video, which will address tracking and reporting as one of the 4 outpatient core elements as defined by the Center for Disease Control and Prevention, also known as the CDC. The primary goal of this project is to increase the number of outpatient settings that have incorporated the 4 core elements of outpatient antibiotic stewardship, and we have released a video for each of the 4 core elements. The core elements themselves, as well as the tools and strategies for implementing or enhancing them, will be the focus of this presentation. Specifically, we're asking for emergency departments, emergency services, urgent care centers, physician offices, clinics, and community pharmacies to view and implement at least one of these strategies to increase your organization's education and expertise for antibiotic stewardship. My name is Deanne Richards, and I am an infection preventionist project specialist with the Lake Superior Quality Innovation Network that serves Michigan, Minnesota, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. The core elements of outpatient antibiotic stewardship provides a framework for antibiotic stewardship for outpatient clinicians and facilities that routinely provide antibiotic treatment and were developed through a combination of consolidating evidence-based antibiotic stewardship practices and building on or adapting known best practices for antibiotic stewardship across other clinical settings. In September, I reviewed commitment. October, I discussed action for policy and practices. And in November, I provided examples and information on tracking and reporting. If you did not have an opportunity to view these videos, you can access them through the webpage www.lsqin.org/initiatives/ASP/. Now, time for today's topic, education and expertise. This core element is broken down into 2 parts, patients and clinicians. First, I'll discuss patient education. Patients should be informed that antibiotic treatment for viral infections provided should not be used. Giving a consistent message helps the patient better understand that antibiotics shouldn't be used for each and every infection. Educating patients, parents, or caregivers about the potential harm of taking antibiotics, especially when they're not necessary, is an important step. This includes the side effects of antibiotics, including nausea, abdominal pain, diarrhea, and the potential allergic reactions. The third item, providing patient education materials, allows individuals to review or refer to the information as needed. The CDC offers several pre-made, ready-to-print materials for patient, parents, and caregivers. Be sure to incorporate the education you have selected into an existing process to ensure consistency between all staff. Next is clinicians, which can be addressed in one of 3 ways. Providing face-to-face educational training, also known as academic detailing, can be provided by peers, colleagues, or opinion leaders, including other clinicians and pharmacists. This can include reinforcement of techniques such as peer-to-peer comparison to facilitate changes into antibiotic prescribing practices. Another item which could be incorporated is providing continuing education activities for clinicians. Education activities includes those that address appropriate antibiotic prescribing, adverse drug events, and communication strategies about appropriate antibiotic prescribing that can improve patient satisfaction. Communication training in which clinicians are taught to assess patient expectations, discuss the risks and benefits of antibiotic treatment, provide recommendations when to seek medical care if the individual is worsening or not improving, or basically a contingency plan, and assessing the patient's understanding of the communicated information. By taking these consistent steps, it leads to a sustained decrease in inappropriate antibiotic prescribing. Finally, ensure a timely access to person with expertise, such as pharmacists, medical or surgical or infectious disease consultants, who can assist the clinician in improving antibiotic selection as well as how to prescribe at what dose, and for the amount of time for patients with conditions that may be tricky. Ensure the staff know how to contact this or these individuals. Although the core elements provide a framework for outpatient antibiotic stewardship, implementing the elements requires thoughtful and consistent efforts to achieve desired outcomes. This includes developing strategies and preparing individuals, facilities, or organizations for change, developing and testing stewardship interventions, identifying and addressing barriers to change, and evaluating progress towards stated goals. Outpatient settings remain a crucial component of antibiotic stewardship in the United States. Establishing effective antibiotic stewardship interventions can protect patients and optimize clinical outcomes in the outpatient health settings. LSQIN participants are encouraged to refer to your toolkit, which includes additional information on tracking and reporting. Individuals outside of Michigan, Minnesota, or Wisconsin are encouraged to contact your own local quality innovation organization. Thank you for joining me today, and I hope you'll take advantage of all 4 of the videos on outpatient core elements related to antibiotic stewardship.